Well, now we're going to talk about the latest skinny on fat reduction, skin tightening, and cellulite treatments. First of all, we have to talk about body contouring and the light. And when we talk about body contouring, we discuss different aspects: fat reduction, skin tightening, and how to treat cellulite. Let's start off talking first about fat reduction. What's the newest technologies here? Well, this isn't so new. This is cryolipolysis or cool sculpting. A lot of people have heard about this, where they actually apply a suction area to the area you want to remove on your body where there is localized fat. This is what it looks like when it's applied, say, to the flank area. And you get a little bit of modest flattening with it. You often require multiple treatments with cool sculpting. But recently, there have been a lot of different side effects, issues with cool sculpting, one of which is called paradoxical adipose hyperplasia. And here we see actually a production of more fat instead of less fat as a result of doing a cool sculpting, and it actually requires liposuction to correct it. Here are some examples of it. And also another side effect from cool sculpting has been the delayed onset of pain after the treatment. So here's an example. This is a gentleman who wanted to have his abdomen flattened with cool sculpting, and he ended up getting more fat in the area. Paradoxical adipose hyperplasia. This woman had cool sculpting on her abdomen. Look at the big bulges that she got after cool sculpting. She ended up with more fat rather than less fat. And you have to do liposuction to get rid of it. So there are newer approaches, some non-invasive. This is a radiofrequency device called Vanquish. You can see this actual radiofrequency shield here that's applied to the abdomen, excuse me, and basically requires several treatments. And here's some before and after photos of the abdomen after Vanquish. The only problem is that you can only do it on the abdomen and thighs because it has this big applicator, so it's not that customizable, and it does require several treatments. One of the latest approaches is sculpture for non-invasive fat removal. It's been tested in many centers, and now hundreds of subjects, in fact. And it's a hands-free device. They just apply the applicators to the area which you need treatment for, and the person walks out of the room. It only requires a 25-minute treatment, usually 2 treatments. We do one and then wait about 6 weeks for the second if necessary. And we're getting long-lasting results. Well, how does sculpture work? Basically, it causes heat in the deep tissues of the fat, which destroys the fat, but it doesn't damage any surrounding tissue. It actually has contact cooling right here. You can see, so it's very comfortable. And here are some examples before and after. You can see the improvement in the fat layer. Take a look here, before and after. A side view of the abdomen. This is after one treatment. Another example of the abdomen. You see before and after. How nice, flattens very nicely. And we'd also do it now on the neck area where people have double chin just by applying this headset. This is what sculpture looks like immediately after the treatment, compared to cool sculpting, where you have this sort of frozen fat that lasts for a while and actually makes you feel quite numb as a result. And here are some before and after photos of sculpture on the neck area. Take a look at the neck before and after. You see a nice flattening here. Another example, take a look here before and then after. Reduction in the fat layer in the neck area. Take a look here, before and then after. A nice tightening and reduction of the fat from sculpture. Another example, take a look here, right here, before and after. Nice tightening effect and reduction in the fatty layer. And another example as well, before and after. Look at that. That's quite dramatic. And we can really apply the applicators anywhere where there's localized fat deposits, all different types of configurations, upper abdomen, lower abdomen, different areas of the flanks, And here's what it looks like when the applicators have been applied. 25-minute session, and the fat goes away. Now, we know there are a variety of different energy sources used today for body contouring. I mentioned radiofrequency and cryolipolysis, cool sculpting, lasers, as well as ultrasound. But they so far have only addressed the fat layer. They don't really address the muscles. They don't really address the core or address muscle laxity after women have pregnancies. And they certainly don't do non-invasive buttock procedures. Well, what does? Well, things that treat the muscle. We know if you look at the underlying canvas of the body, 35% of the body is muscle, compared to 25% being fat and 16% being skin. And also over time, as we all age, there's natural muscle loss just due to the aging process alone. After the age of 30, you can lose as much as 3 to 5% per decade and up to 30% of your muscle mass in your lifetime. So a technology that really builds muscle and really can eclipse what exercise can do in the same amount of time can really be not only a cosmetic benefit, but also a major anti-aging advance. And that is what Emsculpt is. It's called HIFEM technology. We call it the fourth dimension in body contouring. And basically, it not only causes hypertrophy or thickening of the muscle, it actually produces new muscle mass. But at the same time, it's doing that because it has these rapid contractions of the muscle, usually about 20,000 contractions of the muscle in a 30-minute period. It also breaks down adjacent fat at the same time. So it builds muscle and also reduces the fat layer as well. This is what the applicator looks like. It's a large applicator. It can be used on the abdomen. We're going to use it on the butt to build muscle mass. We call it non-invasive Brazilian butt lift. And it also tones the butt, gives you lift to the butt, as well as sculpting the abdominal muscles. We've done multiple studies now with my colleagues, as you can see here. And the results have been shown to last for up to a year using MRIs, CT scans, as well as histology. And here you see an example of a 24-year-old woman on the abdomen before Emsculpt, and the nice reduction in the fat, but also nice sculpting of the muscle. This is an example of an ultrasound scan showing the thickness of the muscle before, as you can see here, and then a reduction here in the thickness of the fat layer as a result of Emsculpt. And here's a three-dimensional image showing not only a reduction in the circumference of the abdomen, but also a reduction in the volume as well. So there have been multiple center studies that have shown that Emsculpt works, with patient satisfaction being very high. There have been absolutely no adverse events from Emsculpt. So this has really been one of the most meaningful advances that have come along in a long time for body contouring. So patients asked us, when we started doing their abdomens and their butts, what about building muscle in my biceps and triceps and calves? Well, the company came out with these smaller applicators. We also did a study for them using the smaller applicators. We did 10 subjects. We did 4 treatments, and that's all you need to do with Emsculpt. You do 2 treatments a week for 2 weeks for a total of 4 treatments, 30-minute session each. It's only a 20-minute session when we're doing the arms and legs. And in this study, we measured the thickness of the muscle as well as the reduction in the fat layer. What did we find? Well, on the biceps, a 15% increase muscle thickness. On the triceps, a 14% increase in muscle thickness. And the calf muscles, or the gastrocnemius muscles in the calf, of a 13.6% increase in the muscle mass. But at the same time, a reduction in the fat thickness on the arms and the calves, as well, as you can see here. And here are some examples of nice toning triceps before and after. Look at the nice increased definition, again, before and after, with the increased definition of the muscles of the triceps, improved muscle definition of the biceps, as you can see here, before and after, a nice toning and sculpting of the biceps. And also an example here of the calves, before and after. Look at that improved definition of the gastrocnemius muscle of the calves. Another example here of the calf muscles before and after M-Sculpt treatments. Again, non-invasive, no downtime, no side effects. This is what you look like when we're putting the applicators on your bicep muscles. We have you lie on your back to do the triceps muscles as well as the calf muscles as well. Just a 20-minute treatment for the arms and legs, 30-minute treatment for the abdomen and the butt. Let's talk about skin tightening. What are the latest advances here? Well, the first question to ask is, how does skin tightening actually work? Well, basically, we have to heat the dermis with different types of energy to get new collagen formation. And basically, it occurs in two stages. We have immediate collagen contraction, and then long-term collagen stimulation that leads to actually new long-term collagen. And there are different approaches. There are non-invasive external approaches with laser, radiofrequency, ultrasound, and infrared, and then internal minimally invasive procedures that are done under local tumescent anesthesia with either laser or radiofrequency. And these are really the target areas that we usually approach for skin tightening: the neck area, the jowls, the abdomen, particularly in women who've had multiple pregnancies, the upper arms, where you get this flabby changes on the upper arms, or bat wings as they're called, and then drooping and laxity of the eyebrows and the eyelids as well. So fractional CO2 is one example for tightening. You can see the nice surface change before and after the fractional CO2, areas around the mouth before and after, with nice tightening of the skin there as well. And here we call this the MADONNA lift, where we use a fractional CO2 laser to take away the wrinkling, as you can see before and after on the lower eyelids. Another example here of the same person, frontal view, before and after with the MADONNA lift. Now there's also radiofrequency that's used for skin tightening, and this is basically an electric current that produces focal thermal damage in the dermis and without affecting the epidermis. Different types of radiofrequency. But the nice thing about radiofrequency, are going to be used on all skin types. This is an example of needling with radiofrequency. You see little needles coming out here and basically injecting radiofrequency into the skin. And then another example here, this is Excellis Ultra. And here we combine radiofrequency and ultrasound to get nice improvement for skin tightening. And basically you can adjust it to go deeper or more superficially, just depending on which area you're treating. And here's some before and after photos of the neck skin before and after Excellis Ultra. And another example of the neck skin before and after treating with Excellis Ultra. Let's talk a little bit about threads. Now, you may have heard about permanent threads in the past. They were basically overpromised and underdelivered. There are a lot of side effects from it. But the most recent advance has been what we call resorbable threads. They're not permanent. They basically get absorbed over time. And the first one was the Cellulite InstaLift. And basically it addressed the issues we had with the other types of threads in the past. And these are basically threads that have these little cones on them. We can do it to tighten the mid-face area or the neck area as well. Usually it's a 45-minute treatment done under local anesthesia, but very quick and easily integrated. No side effects or downtime. And this is what the threads actually look like with little cones on them. And these are the types of patients, getting some sag in here, the jowls and the mid-face, deepening of the laugh lines as well, the marionette lines too. And we basically insert these threads on the sides of the face, usually 3 on each side. You can also do it on the neck area, 3 on each side as well. And here are some examples of the jowl before and after the Cellulite InstaLift. See here, another example treating the platysmal bands here, the loose neck skin before and after with a nice tightening of the skin in that area. And now we've shown that it actually lasts for at least 1 year. This is a woman who had deep laugh lines before. And then at 1 year follow-up, you can see that she still maintained the correction from the Cellulite InstaLift. So let's talk about minimally invasive laser treatments for skin tightening. One of the newest approaches is radiofrequency in addition to lasers. And here we have energy that comes from two different electrodes. One that goes under the skin, and this is done under local anesthesia. And this electrode goes above the skin. This is the face tight, acutite, and body tight treatments. You can see a close up here. And basically we can tighten the neck skin, abdominal skin, the flanks, the bra line, inner thighs, and other areas wherever there's loose skin. And this is what it looks like in this animation. This is the electrode under the skin, and then the electrode above, and the energy shoots from the top to bottom between these two electrodes and stimulates new collagen formation to tighten the skin. We have a large applicator for the body, and then a smaller one for the face. We even have a tiny one, the new Accutite handpiece, that is really so small that we don't even have to make an incision because it's the size of a needle. And basically we use thermal imaging to be able to see how much energy and heating is produced by the face tight and body tight treatments. And here's a little video showing how we use the Accutite, this little electrode that goes under the skin, because it is so tiny you don't even need an incision. You can see in this animation how the energy shoots between the two electrodes, one below the skin, one above the skin. This is one of Dr. Karimi's videos. You can see how it works just by making a little nick in the skin like a needle stick. You do it around the eyes, around the mouth. And here's an example. He's just putting the electrode under the skin and giving that nice tightening effect. Here's some before and afters of face tight, the neck skin before and after. Another example of the neck skin before and after as well. And you can combine face tight and body tight with microneedling radiofrequency on the surface with what is called the embrace treatment, a combination of two treatments to maximize tightening as well as nice improvement in skin tone and texture. What about other minimally invasive approaches? Well, when we have to inject local anesthesia, there's often pain involved, and we use this technology called Pronox now. So we can basically have you just suck on this tube, as you can see right here, and the person just inhales nitrous oxide, laughing gas, while she's doing the treatment, and you really don't feel anything at all. You're very relaxed. There's no discomfort. It's so safe. You can actually, it wears off so quickly, in fact, that it's so safe you can actually drive after having this treatment. Well, let's switch gears and talk about cellulite. What are the newest treatments for cellulite? Z-wave, this is what we call extracorporeal shock wave therapy. This is one of the newest approaches. And basically, we do a series of treatments here. This is non-invasive, no downtime. And here you see an example of cellulite before and after, nice smoothing out of the skin from the Z-wave treatments. Another example before and after with treating cellulite with Z-wave. Minimally invasive treatments, really the most effective has been cellulase. This is actually a laser, and it's a real innovation in that in typical lasers, you see the energy shoots out here from the end of the laser fiber, but with cellulase, it actually splits the laser beam in two different directions. So one goes straight out and one beam goes sideways. So when we're under the skin, we can direct the laser in different directions. We did a study that we published in a journal, medical journal recently with cellulase to determine how effective it was for treating cellulite. We did only one treatment. And this is what is called three-dimensional imaging. You can actually see the depth of the dimple in yellow and the raised area here in blue. And after the treatment, you can see the dimple goes away, the blue area fades over time and shows you the actual improvement in the cellulite. And here's a regular photo of the cellulite before cellulase treatment and then after 6-month follow-up. We've had follow-ups now up to 7 or 8 years after the treatment with long-lasting results. Another example of cellulite before and after treatment with cellulase. So this has been a very effective treatment, 6 and 7 year follow-ups, long-lasting results, no adverse events. And this has really been a significant advance in the treatment of cellulite. One of the newest approaches, which actually is not FDA approved yet, is collagenase Clostridium histolyticum, or CCH. And this is basically an enzyme that targets and lyses collagen fibrous bands. It's been approved for two conditions: Dupuytren's contracture, where you get contractions of the fingers, and Peyronie's disease. And we did the FDA trials to determine the efficacy of the CCH treatments. And basically, we did 3 sessions, one every 3 weeks for three total sessions. This was a double-blinded, placebo-controlled study. We injected the CCH into the dimple itself, as you can see here. This was a scale we used to measure the efficacy. And what did we find? We found a statistically significant improvement in CCH compared to the placebo or non-treatment side. And here's an example of the cellulite before and after treatment with the CCH injections. This is actually the first time we've been able to use injections to treat cellulite. Another example, before, a significant improvement in the cellulite after the CCH injections. Patients rated it as very much improved, as you can see here, statistically significant improvement in cellulite. And the only adverse event, you get some bruising after the CCH injections, which goes away usually in a week or 2. It's usually on the butt of the thigh, so it's really obviously not very noticeable. So in conclusion, we found that the CCH significantly improved cellulite severity and appearance in women with moderate to severe cellulite on the buttocks. We also found it on the thighs. And we're just waiting for the FDA approval. So in conclusion, we've had multiple non-invasive and minimally invasive body current techniques we've just talked about. We at JUVA have pioneered many of these cutting-edge technologies, and we basically customize them based on the specific changes we see in our individual patients. So this is what we expect to be the new look for summer, the trikini, as you can see here, just a little levity about what's going on. Just to remind people, we do have limited office hours as well as virtual video consults. You just call our office to make appointments. We have JUVA self-care skincare packages for acne-prone skin, anti-aging regimens, hair loss treatments, as well as a package for sensitive and dry skin. And now you're getting not only 15% off, a much higher percentage off with the Girls Night In event to support COVID philanthropies. So thank you very much for your attention. We appreciate it. And you can go and obviously see other events during our virtual Girls Night In events.